Hi, everyone. Thank you for joining us. I'm Kim Stern, and I'm the program manager at MCHRI. Today's info session is for our research on structural racism, social injustice, and health disparities pilot grants. The info session will be led by Dr. Anisha Patel and Dr. Lisa Chamberlain, our program chairs. And then before I give them the floor, I just want to go over a couple of items. We have a few slides, but most of this 30 minutes will be dedicated to the Q&A. I know that some of you did submit a few questions beforehand, and we will answer those. And if you have a question, I think you can just type it in the chat, and then I'll moderate those at the Q&A time. And then I think that's it. So I'm going to hand it over to Anisha and Lisa.
So thank you all for taking a little time on a Monday. Happy Monday, everyone, to join us. Really appreciate that. And this is a new initiative that we have excitedly undertaken. It is a work in progress. And so we are looking forward to sharing with you our ideas, our thoughts, as transparently as we possibly can, share with you how we're trying to receive the proposals and think through how what people are proposing matches up to our goals. And that's why we wanted to have an information session, because we want to share as much as we can. But the majority of this time we have structured to make sure that there are lots of times for questions and discussion. So we're just going to take like 5 minutes to do a quick overview, and then we really want to open it up to questions that people may have and or thoughts. How can we make this better? We are definitely something that is evolving. So I'll just jump in. This was this proposal, this call for RFP, this initiative to create some funding streams to promote health equity through research is something that is very important to our chair, Mary Leonard, and increasing importance to our department over the last year. And so that it is really her vision that I am appreciative of to be able to have this opportunity for all of us. And our thinking about why we want to promote health equity through research, we think it's increasingly important to address the impact of structural racism and social injustice as key drivers of health disparities that affect women and children's health outcomes. These structural issues definitely influence health. And as we kind of advance a health research agenda, we want to start bringing in those thoughts and ideas and pathways. We also think it's a real opportunity to highlight important child and maternal health disparities, the differences that exist across racial and ethnic groups, socioeconomic groups, geographic, and by that we mean urban and rural, different groups, different kinds of sexual orientation and gender identity, SOGI categories. So we know that there are differences there, inequities, and it's an opportunity to highlight those. We really want to focus on the reasons behind these. So in other words, sometimes we just need to describe that it's out there, just pure descriptive surface. There are different levels of these in different groups, but a lot of times that's already known in the literature. So we want to kind of push the research world forward to think of what are the drivers, what are the things behind that. And then as often as possible, we would love to see our researchers moving in a direction with community partner engagement. So how can we answer these questions as researchers in a community participatory fashion, how we participate with our community partners who are really experts in many of these ways and have much to teach us. So those are just some of the big picture framing thoughts that we have around this work. With that, I'll hand it over to Dr. Patel.
Great, thanks so much, Dr. Chamberlain. So as you probably all are aware, reviewing, maybe you haven't had a chance to review all that information online since the grant application deadline is still a little bit of ways, but there are a number of documents online that specify the review criteria for all the MCHRI grants. Those are pretty consistent with review criteria for National Institutes of Health, and so you can take a look at that. But for this specific round of proposals and this particular mechanism, there are specific review criteria that the reviewers are going to be paying attention to. And so we wanted to highlight those that are different from the usual MCHRI criteria today. And as Dr. Chamberlain mentioned, the goal of these proposals really are to engage in diverse and inclusive research that addresses the impacts of structural racism and social injustice as key drivers in health disparities. And so, you know, we're looking for that type of research, and you'll see in the background section and other parts of the application where you have a chance to really highlight that and articulate that. The goal of these proposals, because they are pilots, are to fund seed projects. So really thinking about the feasibility of this in a $35,000, you know, maximum grant proposal, and how these seed projects can help lay the foundation for larger endeavors. That could be pilot data for a larger proposal to a federal agency or a large foundation, or perhaps piloting instruments that will be used in a larger data collection effort. The project should also highlight important problems or barriers to progress in maternal and child health disparities, and how the proposed work will actually address inequities or close the gap. So as Dr. Chamberlain mentioned, it's not just describing the disparities, but taking it a step further and really identifying why those disparities are occurring and how can we address those. The method should be as rigorous as all the other proposals that MCHRI accepts, and you'll see that reflected in the review criteria. It's important to think about, you know, really developing your study questions, study design, data collection methods, and analysis plans, as well as dissemination. Next slide. Thank you. So then other point for the review criteria is making sure that the investigational team has the experience and expertise to perform the study. So for example, if you're proposing to collect qualitative data, do you have that expertise and experience on your team? The applicants shall also seek to collaborate with key stakeholders in the community, again, thinking about community engagement. So those could be advocates, policymakers, school and community leaders, parents, and youth. Really depends on your research questions and areas of interest. There should also be a clear plan for engagement with the priority populations across those different disparity groups. So again, racial, ethnic, geographic, or sexual orientation and gender identity. And lastly, the proposal should outline specific plans for disseminating the results and findings back to the community members and audiences who can benefit from the research, and even take the findings and use it for their own purposes, potentially grant applications or future initiatives. Dr. Chamberlain, I'm going to turn over the timeline to you.
So just kind of wanted to close before we open it up to your questions. Here's a quick timeline for our next cycle. Today, info session, we're having that, check. And then proposal submission deadline is April 19th, and we anticipate announcing who we are going to seed on kind of third week of June, and with a start date of July 1st. So we wanted to give people plenty of time to have conversations with community partners to build that team that you might need, so that folks have time to, you know, kind of get their thoughts together and have this info session way in advance of that. So that's all we have to say. We really wanted to provide this opportunity for folks to ask us questions, ask for clarification. All of this information is available online. But you can also circle back to us separately at other times if you have questions. So with that, I'll stop chattering and see what questions others might have. And Kim, we can also raise the questions that we received ahead of time, as they may be questions shared by others.